Now we are joined by Dr. Kaelin. So Dr. Kaelin is, he is University U of L's endowed chair of stroke and brain injury rehab. He is the chief of physical medicine and rehabilitation at the University of Louisville. He is also the medical director of Fraser Rehab Institute, and he was named top doctor by peers in Louisville Magazine. So we're very thankful to have him today to join us. And Dr. Kaelin is going to speak to you on sort of how give you some tips on how to take the information we've given you today and through our series and evaluate other therapies, and to sort of give you his tips on that process. So let's see. Dr. Kaelin, are you ready?
Yeah, I'm ready, Sherry. Thank you.
Okay, great. Did you have any slides, or did you want to just
No, I think we can just kind of discuss what's been on your slides and then certainly open it up for questions. I'm sure a lot of people on the call have some interest in knowing my thoughts or our thoughts on different techniques, different technologies that exist, rehabilitation options. So first of all, I want to say thank you, Sherry and Izzy, for inviting me. Welcome everybody on the call. I'm a physician specializing in rehabilitation medicine and particularly neurologic rehab. So I've spent 30 years of my career understanding and trying to facilitate neuroplasticity. And so this is something that's very near and dear to my heart. I think what's been said up to this point is very important, which is that you have to educate yourself. You have to make sure that you're prepared when you go to the doctor with a set of questions and that you don't leave without getting those questions answered, that you are prepared to answer questions that might come your way about the intensity or the severity of your condition, what you've been doing, what works, what doesn't, so that you can partner with the physician on coming up with a treatment plan that will be most effective for you. Everyone on this call is slightly different. Some might have injuries, some might have illnesses. There are those on this call that may have had injuries to their brain or their spinal cord. There may be some that have had strokes. There may be some that have MS. There may be ones with dyslexia, attention deficit. All of these things affect the nervous system. And through different kinds of rehabilitation techniques, new technologies, medications, etc., we can continue to improve our nervous system. When I was a young physician, we were kind of told that about a year and a half to 2 years into your illness or injury, after recovery, you're about as good as you're going to get. I now know that that is not true, and that we can continue to improve our nervous system and improve our function with certain things that we can do. So the first thing I would say to everyone on this call is don't ever give up. Keep working, keep trying to move forward, learn what skills and techniques you can incorporate into your daily routine that will help to make you better, and you will see change over time. It's the minute you start giving up and the minute you say this is as good as I'm going to get that you're going to stop improving. So I encourage you in that way. Secondly, realize that not all physicians have expertise in this area. So you need to seek out someone in your area who understands recovery, rehabilitation, neuroplasticity. It could be a neurosurgeon, it could be a neurologist, it might even be a holistic physician or a primary care physician. But many times it is a physician like myself, what's called a physiatrist or physical medicine and rehabilitation specialist, who subspecializes in neurologic rehabilitation, who will be able to give you some of the skills and techniques you're looking for. You look toward people who are therapists as colleagues in helping you along this pathway as well. Good physical, good occupational, good speech therapist, good psychologist can be a godsend as far as helping you down this path, because you would expect and hope that as professionals, they too are looking at what's out there and available for their patients to help them in their recovery. So having said all that, I think the first thing is when you start investigating treatment options for your recovery, for your condition, realize that, as Sherry said, the internet can be very valuable, but you have to look at everything with, a grain of salt. What do I mean by that? We want to make sure that things that you're being told have evidence behind them, that they're not being driven by profitability and selling you something. And you want to see that what you're looking into has been tested and confirmed to be helpful. You even want to get testimony from people, because there's a lot of things out there on the internet that simply just don't work, but have a lot of people saying, oh, it's the greatest thing ever. So talk to a physician. What I always tell people is that if something really works phenomenally well for the majority of people, then physicians in that specialty know about it and are using it. None of us are sitting around twiddling our thumbs, not aware of what is happening in our specialty. And so we go to national meetings, we talk to colleagues, we're presented by manufacturers and people in research and industry about new products and techniques. And so it's important that you have somebody who's up to date and who is aware of these things. If a patient comes to me with something new that I'm not aware of, it doesn't mean that it couldn't work. It means it's either extremely new or it's extremely unusual, or that it just simply isn't any good. So we have to look into that. I never boohoo anything that somebody brings to me and says, hey, how about this or how about that? But I look into it and make sure that they're not being misled in any way. Then once you know that something has evidence behind it and some potential, then you want to find out if it's particularly good for your condition. So as an example, what might be good for a person with a spinal cord injury might not be good for a person with neuropathy. What might be good for a person with dyslexia might not be good for a person with attention deficit. And so you really got to figure out, even within your own diagnosis, things like the new VivaStim vagal nerve stimulator, that is a technology used to help people with stroke that are several months or even years out from stroke, can be very effective, but it's particularly effective for people with a certain level of function. So you have to know if you're a good candidate for a device. And so you want to go to somebody who has that knowledge and can help you through, guide you through that process. Then once you've tried a technique, whether it's a therapy, an intervention, a technology, you really need to give it some time to see what changes it will make in you. The nervous system takes time to incorporate a new challenge and to make the changes that are necessary. What is that time? I generally tell people about 2 months of consistent effort should start to result in changes that are noticeable. It may not be night and day changes, but changes that you can say, I can see I'm better now than I was 2 months ago. And so you want to give something every bit of 6 to 8 weeks of effort and trial before you say, this isn't working for me. After that point in time, if you're not seeing changes, then you do need to consider the cost benefit ratio, meaning, is it worth my time, my effort, and my money to continue doing something that doesn't seem to be making changes in me? And you want to have conversations with either the physician or the therapist about why you're not seeing changes. Maybe you're using the technique wrong. Maybe you're not doing it frequently enough. Maybe you're wearing yourself out and fatiguing yourself out, so you're not recovering fast enough. There's all kinds of things that can be going on. But if the assumption is that you've been using the new technology, the new technique correctly, and you're not seeing changes after a couple of months, then I'd have conversations about whether you should drop that and move on to something different. Now, one thing that was brought up that I think is very important for everyone to know, it's just like lifting weights. You can't lift 5 pounds all the time and expect to get a lot stronger. You'll get good at lifting 5 pounds, but you're not going to be good at lifting 20 or 30 pounds if all you lift is 5. So part of what the nervous system needs is increasing challenges, changes. It needs to be confused a little bit, stressed a little bit. When we talk about stressing the nervous system, we're not talking about getting overstimulated and stressed out in your everyday life. We're talking about making your nervous system do something that's difficult for it to do so that it responds with a positive change. And so you need to make sure that you're pushing yourself on a regular basis to get better, faster, stronger in some way. And as was mentioned earlier, you want to be very thoughtful about what your goals are. Let's say your goals are to walk better. You can walk some, but you need a cane, a walker. Your balance is maybe off. You need to have some help of someone to walk with you. Well, the important thing to remember is you want to take those movements and you want to break those movements down into smaller pieces and get good at those smaller pieces, adding those pieces then together to make the bigger movement and then get good at the bigger movement. As I like to say, it's not practice makes perfect, but it's perfect practice makes perfect. If any of you are golfers and you go out to the driving range and you see people hitting golf balls, they're going left, they're going right, they're dribbling down the middle, and people are practicing bad golf swings. All they're going to do is get better at hitting the golf ball poorly. So you need to take lessons. You need to know what a good golf swing feels like. You need to be able to correct yourself. And the more you practice a good golf swing, the better golfer you'll be. So the more you practice a good walk, the better walker you'll be. The better you reach correctly for an object and pick it up and bring it to yourself, the better you'll get at doing those things. So task-specific things are very important. And then lastly, I would say that, as in life, there's always the next thing. And you're going to find that no matter what your condition is, something new, potentially exciting, and potentially helpful may come along. And so you're always wanting to keep your ear to the ground, hear what's going on, ask your therapist and ask your doctors, what else? What's the next thing? Once I get past this, then what else is there? Because you're always wanting to continue to strive and improve. We know, for example, that mice who are given spinal cord injuries get up and walk and move within a matter of 1 to 2 weeks, while humans don't. So what's different? Well, one of the main things that are different is that mice know they're going to get eaten or they won't be able to eat if they don't get up and move. So from the very get-go, they move, right? Humans, on the other hand, are often told, lay in bed, rest, take it easy, don't do too much. And in reality, what we often do is hurt ourselves by not being as active as we could be or should be. So again, I'm not telling you to overdo it, but I'm telling you that doing it is better than not doing it. So try to maintain some level of activity on a regular basis. I think at this point, it might be wise for me to kind of stop and see if people either have questions or have specific questions regarding their own conditions that I might be able to help you with. And silence falls over the crowd. I think I've overwhelmed you.
Well, Dr. Kaelin, while we're waiting for a couple people to put some questions in the chat, I
Sure.
did have one question for you. Back to your comment on evidence. What are your thoughts on, because a lot of the newer therapies that are out there don't have the formalized research to support
Right.
what they're doing, but there is evidentiary support. How are you looking at that information to make a judgment as to whether you refer someone?
Yeah, that's a great question. Well, I take each individual case as it comes because what might be helpful for one individual may not be helpful for another. And in fact, in some cases, it might be harmful given a person's condition. So you have to look at what they're interested in trying. I would tell you that most of those things are not harmful. Most of those things are not going to hurt people. The question is whether they're going to help people. So I always weigh the benefit against the risk. And the risk is not only of injury or of lack of improvement, but the risk could be cost as well, right? I've had people come to me and want to go to Florida or California or Mexico for some treatment that costs $10,000 that I tell them without a doubt I know is not only not worth $10,000, but is not going to be effective. But people want to do anything and everything they can to get better. And so when they see things on the internet that get them excited, then they're willing to take those kinds of risks. But I always remind people again, if these things worked all the time or on a great majority of the time, it would be part of our standard of practice. It wouldn't be hidden somewhere in Boca Raton, Florida, or in Mexico or somewhere else. It would be happening in every city in the country. And so I think as long as it's not harmful, it's worth trying. And that's usually how I address each of those individual situations.
And there is, the hope fatigue as well, when people start trying all of these other treatments and then they start to get really discouraged because they've tried them and they're not getting any results. So I appreciate you saying that, like, really look at that return on investment. Is it going to get your hopes up again and let you down?
Right.
Or is it something that you have checked with your doctor and gotten their opinion on?
Right.
We did have one question, Dr. Kaelin, about an individual who has a child with a brain vaccine injury. Mr. Bates, I'm not sure if you want to add anything additional to that chat for Dr. Kaelin.
Brain vaccine injury? That doesn't make any sense.
Maybe she meant a vaccine.
Well, yeah, sometimes what happens, you can certainly 1 in a million get Guillain-Barré, which is more of a nerve condition as opposed to a brain condition. But sometimes vaccines can cause an autoimmune response to occur, where the immune system not only responds to the vaccine in a positive way, but starts to attack the body in a negative way. And so when that
to hear this crap,
Well,
we'll take it and run.
I think we
occasionally.
I'm sorry, just 1 second, please. I want to make sure that everyone is on mute besides Dr. Kaelin.
Yeah. And so if a person were to have an injury to their brain that was the result of an autoimmune response, then it certainly doesn't just attack usually one part of the brain. It can be very diffuse. But the recovery patterns would be similar, meaning that you want to work on motor skills, cognitive skills, all the things that have been adversely affected. And so, as was mentioned in earlier slides, looking at physical activity, looking at cognitive activity, looking at things for kids, especially video games that work on cognition and reaction and visual scanning and things of that nature, but also physical activity, standing, stepping, and so forth if possible. And so having a good rehabilitation specialist to kind of walk you through that process is very helpful. And most large cities in the United States have pediatric rehabilitation specialists. There's about 300 to 350 in the country. And so I would seek maybe one of those out if your son or daughter is of that age, to see if they have additional answers for you.
Yeah, and I think you hit that. He said antibodies were attacking the brain.
Yeah.
Any other questions? You can put it in the chat for Dr. Kaelin. Anybody in the audience here? Okay. No? Okay.
Well, thank you so much.
Absolutely.
Oh, wait, we have one more. We have a question.
Okay.
Yeah, my husband had a stroke on April the 12th, and he was at Suburban, and he ended up in his treatment and therapy and stuff at Fraser.
Okay.
Yes, y'all did do a good job. He still ain't got home yet. He's in the nursing home.
So for anybody that can't hear, her husband recently had a stroke and she ended up at Fraser, and she was thanking you that you all have done a great job, and he's not home yet, but he's getting improvement.
Right. And
That's great.
encouraging him, don't stay in your room, come out of your room.
Yep.
Go to activities. He's in a wheelchair. I call him.
Staying active.
Yeah. Well, one thing I will tell you, the good and the bad of nursing facility level rehab, right? The good of it is that it allows you to extend your therapy out longer, right? He's getting more rehabilitation now than if he would be just at home doing things on his own. There's a blessing in that. The downside of that is because of the healthcare system that we live in, there's going to be a point in time where they're going to stop doing that therapy and they're going to do what's called maintenance therapy, which really isn't very valuable from a standpoint of helping him get better. It might slow down him getting worse. So it's really important at that point to step in as a family member, as friends, get groups together, try to make sure that he's socializing to keeping his brain active. He's going into the therapy gym or going out and doing things that are physical. There's exercise groups, and then having people come in and work with him individually. That'll keep him moving forward, and that's what's really important.
Doc, and I'm gonna stay on top of it.
She's going to stay on top of it.
All right, very good. That's the key. Go get him.
I'm a firecracker.
I can tell.
Firecracker. She's been here with us for every single session, so she's been on top of it and engaging.
I come looking for y'all, y'all don't come looking for me. Nice to meet you, Doc.
Well, Dr. Kaelin, we appreciate you for joining us. Thank you so much.
My pleasure.
Yes, and you had some very good feedback, and I love your perspective, quite frankly, how open-minded you are, and how open-minded you are, and looking at all of everything and above that's out there and giving it full consideration. So your attitude is fantastic. Thank you.
Well, thank you. God bless everybody, and we'll talk to you soon. Take care. Bye.
Okay. Thank you, Dr. Kaelin. Bye-bye.
Everything we got going on with valuable. You know, it sounds like